So where did you develop this affinity for the recovery world?
So it probably was kind of twofold. One was, I have family that are, in recovery, and so seeing the great change that can happen for their life and for those around them, really drew me to that. And then the other one was kind of just happenstance. I worked at a rehab for my first job outside of college, and just really fell in love with the idea of being able to see so much change and growth in a pretty short period of time. And so that's where I really kind of said, like, I really want to be part of this.
Well, and Bill Wilson in the 12-step book says, nothing will take a person out of themselves as much as working with someone else.
Yeah, yeah. There is just something to get of, helping somebody else kind of move to an area where they didn't think they could. They always had the strength and ability inside them. They just didn't always recognize it or know how to get there.
So everything that you've done in your life has put you in a position to succeed.
Yeah.
Everything that you've done in your life, quite often what I tell people is, you've lived through every bad day of your life.
It's true.
You've lived through every single one of them.
Yeah.
So could you give us a little history of Arc Manor?
Yeah, so Arc Manor has been around since 1974. Really started with a really small, just group of grassroots folks that kind of got together and said, there's a problem in our community and we need to do something about it. And then since, it's just kind of grown. We moved in early mid 90s from West Katanning down to Katanning to our site here, and we've been able to kind of have a residential center. We do lots of outpatient levels of care, including partial hospitalization, IOP. We recently increased our residential capacity to 13 beds, so nice and small. So we get to really offer, an individualized, program for folks to come through and not kind of get lost in the program.
So a lot of times people say, oh, I'm going to an IOP, I'm going to these things. Most people have no idea what those are.
True.
What type of services do you offer here?
So we do offer the partial hospitalization, which is a pretty intensive 5-day-a-week program. Folks are here at least 3 hours a day for groups, and then they get 2 individual sessions a week as well. So it's a lot of treatment. It's for folks that really are struggling, that either need quite a bit of support. It kind of helps prevent them having to go into a residential center or hospital. It's also great for folks coming out of a residential facility to try to just transition back to that independent living. Gives them enough support and structure to be able to get those skills to be able to really succeed well.
And these groups involve?
So they kind of have a lot of different topics. So, relapse prevention, basic education on recovery, developing a new support system. We also talk about stress and mood management, how to cope. And we also talk a lot about physical health needs. We have a nurse navigator. She's an RN who's here that runs groups and does individual appointments with folks to be able to connect them to make sure their health needs are taken care of.
Connect the mind, body, spirit.
Yeah.
And quite often people need help just simply with activities of daily living, writing a check, finding a place to live.
Yeah.
Getting enough to eat.
Yeah, so we definitely connect them to case management services. The Armstrong, Indiana Clearing Drug and Alcohol Commission does an excellent job at providing all of those services to our folks in this area. So, we use them. They have certified recovery specialists to help, make sure that they get connected to those outside resources and extra supports so that really they have the best foundation for their recovery.
Could you tell people what an IOP is?
So IOP is the Intensive Outpatient Program. So it's essentially one step below partial and one step above just a kind of typical outpatient. So for hours, it's 3 days a week, 2 to 3 hours a day of group on those times, and then individual sessions as well. So it's still a pretty intensive program. We're talking, a lot of hours that people have to dedicate towards treatment, but really learning those skills so that they can then, succeed really well.
Where do you evaluate, where you determine that someone needs a higher level of care and perhaps go inpatient?
Well, so that can be done, initially at the intake or the assessment. So we kind of do a complete psychosocial. We have to get, all this information about, current and past situations that have experienced with them. And then we really kind of make a determination based on ASAM criteria. So, it's kind of set up nationally of kind of what the standards are for the level of care. And so we have to make sure that an individual fits for that level of care. But then also, if they start out in outpatient or IOP and are really struggling, then at any time we can do kind of a reevaluation or reassessment to see maybe a higher level of care is necessary right now.
One of the barriers to get treatment, Mike, is financial.
Yeah, it definitely is. It's expensive and it's hard. So, we're fortunate enough to be able to offer services, to folks that have, insurance, whether that's private insurance through a couple different ones, or the Medicaid, private or public assistance, and then also folks that maybe kind of fall in between that and don't qualify for either public or private insurance. Then oftentimes the Drug and Alcohol Commission are able to kind of step in and fund, and they do a great job. Like, that's kind of what they're there for, is to be able to help those folks that just really kind of don't qualify for some other funding sources.
And this is what really is an obstacle for a lot of people, because they don't know how to access these resources.
Yeah. So, I mean, there's essentially like a no wrong door approach. So, people can come here to Arc Manor, call us or stop in. They can go to the Drug and Alcohol Commission and talk to a case manager. The Drug and Alcohol Commission has a great program that's in the hospital. So if people end up in the ER and they say, yeah, I really need some help, they're able to see a case manager or a certified recovery specialist in the hospital and get a referral there. So there are lots of opportunities now. It's just reaching out
to make things available and
Yeah.
ask for help. So what do you say to people who say, I do have a problem, however, I can't take time away from my job?
Yeah, so I mean, we try to be as flexible as possible, try to meet them where they're at. Eventually it might come to a point where, it's clear that it's not going to be working at just 1 day a week, or, whatever the initial evaluation might say. And then we kind of talk about the consequences of not getting help might lead to more severe consequences. And so we don't want that.
And again, there's the stigma of going inpatient. And one of the misapprehensions about misconceptions that people have is, I know I had it myself, I didn't believe anybody else really knew.
Yeah.
And that's a common thing. But however, the families are so important to be involved and educate them. Could you tell us about some of what you do?
Yeah, so we, in our residential center, we have, family night where they come in, have a group, kind of get that education, also so that the family knows that they're not alone. And they also need some skills of how to best help their loved one. So we include them in that. They can get family sessions, whether it's inpatient or outpatient. Any client of ours can get a family session with their therapist to be able to help, really strengthen or, kind of rebuild some of that trust that probably has been broken. And then there's also a community a family support group that's going on that the Drug and Alcohol Commission helps fund as well, that we support as well. I think it's really important for our families and our community to know that there is a support group out there.
So after a person leaves here, how about the extended care? How about the care after care?
So, I mean, usually, if somebody has done through residential and then maybe partial IOP and outpatient, that's a pretty long time. So, they're encouraged to be able to connect by that point with a 12-step program or some kind of recovery program that works for them, so that they can continue to have that support in their life. They can continue to work with case management or CRS. They're able to come back at any time, kind of touch base with us, get a new evaluation if something changes, even just to prevent a relapse,
And community education?
Yes, and then we do a lot of community education as well, outreach that we send out, our staff to the community to try to help people know, like you said, where to access, what kind of things should people be looking for, especially parents, what should they be doing?
A person calls you and says, I don't know whether I need this assistance or not.
Yep. So we go through a screening. The state has developed a screening tool that we use to kind of say, kind of triage essentially. Do they need a really high level of care? Do we just, set up a regular appointment for them? And then we do the assessment. And that's kind of where we determine the fact that you're reaching out and asking for some help or the idea of maybe needing help probably indicates there might be something, but we'll do an assessment. We'll find out.
I run into many situations like this, Mike, where a parent or a wife or a husband or a brother or sister will call me and say, "So and so really needs help. They're in bad shape." How do you deal with that person?
Well, so I mean, ultimately, if the person's not interested in coming to treatment, there's not much we can do for that person until they're ready, but we can help the family. So we can offer, individual sessions, outpatient therapy for the family. So you don't ever have to get the person to agree to come in here. Hopefully that happens eventually, but it's a struggle just on the family. This is definitely a disorder that affects the entire family, and so we definitely encourage folks to come
I think
in.
that's a real important point. Quite
Yeah,
often I'll get a call and says, "Can you help my daughter? Can you help my son?" I'll say, "Well, do they have any desire to even come in?" And then I'll say to them, "You know what? It sounds like you're in a lot more pain here than anybody
yeah.
else. I can hear it in your voice. Why don't you come in and let's talk about it?"
Yep, I think that's our way of helping,
Mm.
because we can't get to that person that they see needs help until they're ready, but we can definitely help that person that's struggling, that family member.
The family member that's struggling, they're important
They
also.
definitely are, yeah. And if they can kind of get to some knowledge, some support, some help, then maybe there's a chance that their loved one can maybe notice that there's a need for change as well. So we're willing to help, really anybody. That's kind of our mission is anybody that's affected by substance use, whether it's the individual, the family, or just our community. We are kind of there to help with that.
So I know that you're talking about personal wellness with the patients. You're talking about personal wellness with the family. Let's put the mirror in front of Mr. Mike and
Yeah.
ask about that for himself.
Yeah, so I try the best that I can. It's always a work in progress, though. So for me, it is about being aware of kind of how am I taking care of myself, trying to get the sleep that I need. Is what I talk to folks about. Trying to do that to myself. For me, yoga's been a great source of just physical, but also mental exercise for me that's really been helpful.
Do you take care of yourself, Mike?
I try. It's difficult when there's just so much happening, but I try I really do try my best to yeah, watch what I'm eating, what am I putting into my body, how am I taking care of my body, and really doing some self-care. What's enjoyable for me? I have to be able to have some of those hobbies or interests, as
And how
well.
do you create those boundaries? How do you avoid bringing this into your daily life? How do you often spend most of your time trying to solve other people's problems?
Sometimes it is about like just kind of taking a break, and scheduling out, saying I'm not going to come into work this weekend. I'm going to take time at home. I'm going to go on a trip. Going to go, do something else. Turning off the cell phone. If I'm not on call, then I can turn that off and know that somebody else is going to be able to take care of that. So it's setting those boundaries sometimes, which are not easy, and keep coming with time.
So, what do you say to someone out there who says, "I'm not sure whether my son or daughter has a drug or alcohol problem. I'm not sure. I suspect." How do you deal with that?
And so I think it'd be about some education, for what signs to look for, kind of exploring kind of why. There's some indication there that has gotten them to kind of say, hey, something might be
What
up.
are some of the signs you suggest to people that they might be aware of?
So big ones would be about school behavior. Are they going to school? Has anything changed dramatically with their grades? Anything changed dramatically with kind of their peer group, their mood? Things coming up missing. Are they stealing? Like those are all kind of things to maybe want to look for. If there's money missing a lot, that's going to be something to kind of take a look for. It doesn't mean one of those are definitely an indicator, but the more that you have, the more you want to take a look at kind of something must be going
Are
on.
they becoming reclusive? Are they becoming
Yeah,
secretive?
yeah, yeah. Big mood changes. Are they really angry, really sad? Kind of erratic behavior, getting in trouble a lot more at school or in the community that maybe didn't happen. So we're looking at kind of changes, maybe gradual or pretty sudden ones.
And what are the age ranges that you use for your clientele here, Mike?
So for adolescents, we treat usually 12 to 18-year olds. Starting a new program for in the schools and in pediatric offices so that we can kind of reach kids where they're at instead of trying to get them to come here, which can be a little bit of a difficult, situation for them to want to come to a residential or rehab center like we have. But we can reach them, in the schools. And then mostly for our outpatient, it's, a lot of 20-year-olds and up, so we do pretty much all age ranges.
So, Mike, how would a person contact Arc Manor even if they have a question about maybe a loved one or even themselves?
Yeah, so our 1-800 number is kind of the best bet. So it's on our webpage. People can call in, get information. They can do the screening like I talked about. They can kind of ask some questions about what we offer if they want something more. Our website kind of offers an outline of the services that we provide as well.
And that website is?
arcmanor.org.
arcmanor.org.
Yeah.
And of course, one of the things that I know you have a real mission here, and one of the things that people perhaps don't understand that it takes money to operate this.
It does.
It takes money.
It does. Yeah, so we've been fortunate enough to get some help from the community. We've done some fundraisers recently. We're going to keep doing that. But it is pretty expensive. So some of that noise that you hear in the background is renovations because we are kind of upgrading. But it is expensive to run. So any donations are really really appreciated. So even just ones for the residential center. People that donate extra food from the holidays, that's really appreciated, and really kind of any, we have local churches that donate toiletries for our residents, because we have folks that come in that, really have, nothing sometimes. So we kind of accept those donations on behalf of our folks to be able to give those, new clients something that maybe they don't have.
So Mahatma Gandhi said, be the change that you want to see in the
Yeah.
world. So I applaud you. I applaud Arc Manor for attempting to make the world a better place, Mike.
Thanks
And
for trying.
as a disclaimer, Mike and I went through our master's degree program together, which is one of the reasons why he and I have clicked over the years. And if you have any questions or comments, particularly concerning this program, if you have any questions you want to direct to Mike or any thoughts about Arc Manor, you can certainly contact our program, which our producer will let you know at the end. However, at the end of every podcast, we offer a free prescription, fruits, nuts, and vegetables, and unplug your television, and perhaps take up fishing. And for a truly mindful experience, we suggest that you fish without bait. Forgive yourself, forgive another. Do a kindness for yourself, do a kindness for another. Till all are free, none are free. Namaste.
Please check out our website at fishingwithoutbait.com, where you can listen to the show, comment on our discussions, and find out where you can subscribe to our podcast. If you're interested in flying the colors of Fishing Without Bait, click the shop icon on our website. We have clothing, mugs, cell phone cases, and so much more. Show the world that you fish without bait. This show is a member of the Sorgatron Media Podcast Network. Find out more at sorgatronmedia.com.